Patients have a lot of options now early on in pregnancy as far as tests that can be used to screen for genetic disorders. So if the baby could have a genetic syndrome or a birth defect. And one of the first questions I get when we go over these at the first prenatal visit is, well, is that something I need to do? And they just need more information about it. So that's why it's so important to establish care early in pregnancy so we have time to go over the options. And it's not something I can answer for patients. It's an option, and if they're interested in it, then we have a lot of choices to make right at the beginning. Some patients decide to do this test because they feel like extra information would help them to be prepared if they knew a baby was going to be born with possibly Down syndrome or another genetic disorder. Whereas other patients feel like the test would just make them more nervous and they're going to worry about it and they feel like it would make no difference to them. And so that's why it's a very personal choice on whether or not they're going to do the test. So there are two different types of tests available early in pregnancy. One is called a screening test, which basically calculates a patient's risk of having a baby with, for instance, Down syndrome, which is trisomy 21 or trisomy 18. The other is a diagnostic test, which is actually analyzing the baby's chromosomes to see if they do truly have a genetic disorder present. And most patients will choose to do the screening test first because these are non-invasive. They're not going to hurt the baby at all. There's no risk to the baby. They normally just involve something like a blood test and an ultrasound for depending on which test they choose. And then if the screening test is abnormal, then they'll move on to the diagnostic testing. Early in pregnancy, there are two main options for patients. One is called the first trimester screen, which is blood work from mom and an ultrasound. The other is called non-invasive prenatal testing, or NIPT, which is only blood work from mom. And these are both tests that are done very early in the pregnancy, and they can give us information if a patient is at increased risk of having a baby with a genetic disorder or a birth defect. For low-risk patients, the first trimester screen is a great test to tell them if they are at increased risk of carrying a baby with a genetic syndrome like Down syndrome or trisomy 18. And what it is a blood test for mom in combination with an ultrasound where we're looking at a very specific part on the baby's neck called nuchal translucency. And that comes together to calculate a risk to let the patient know if they're at increased risk of having one of these. The other thing that we get from this blood work is that if some of the blood work is abnormal, even if the test is low risk and normal screening test, we use that to follow babies later in pregnancy, and we can check for things like poor fetal growth or some other problems that might arise. Non-invasive prenatal testing, or cell-free DNA, which is another name, is simply a blood test from mom, and it evaluates short segments of the baby's DNA in mom's blood. And that allows us to determine if the patient is at increased risk, again, of carrying a baby with Down syndrome or trisomy 18 or some other fetal abnormalities. It also does determine the fetal sex, which is why a lot of patients are interested in this test early on. But there are other options. I think it's important, again, to establish care early so you can discuss all the options before choosing which one you want to proceed with. And the non-invasive prenatal testing in our office is done anytime after 10 weeks along. In the second trimester, patients have another blood test that's available, again looking for things like trisomy 21 or trisomy 18. And in addition, in the second trimester, it's checking for things like spina bifida or spinal defects with the baby. They also still have that option of that non-invasive prenatal testing, which is a blood test as well, just a little different way that we're determining the risk if they're interested in that. AFP stands for alpha fetoprotein, and what this is a blood test from mom. We offer in our office between 15 and 20 weeks, and often as soon as we mention it, patients say, well, I don't know, is that something I need to get? And again, it's another screening test, so it's completely optional, but it checks for spinal defects or abdominal wall defects of the baby. And most of my patients, if they've had the early genetic screening, like the first trimester screen or the non-invasive prenatal testing, I recommend getting it because it in essence completes the screening that patients have available. If this is a negative test, again, it's reassuring, and if it's positive, it's something we need to look into more. Of course, it's scary for patients if they find out or we call them and say one of these screening tests was abnormal. And the important thing to know is that does not mean at all that your baby has a genetic disorder for sure. And there are additional tests that we do if they're interested in that to find out more information. In my practice, of course, we bring patients in to kind of go over these results. Normally, I will refer them to a genetic counselor and the high-risk pregnancy specialist to do the further testing. But just in general, there's two options. One is to sample actually the placenta to determine the chromosomes, and the other, more commonly, patients have probably heard about what's called an amniocentesis, which is sampling the fluid around the baby, again, to determine the chromosomes. But the important thing, again, to know is this is not 100%. You can have an abnormal screen and go on to deliver a normal, healthy baby with no genetic syndrome, but we just need to look into it more. Healthy individuals can be a carrier of a gene and not have any symptoms of a genetic disorder. And so that's where carrier screening comes into play. And it's important in pregnancy because if the mom is a carrier of a gene and so is the dad, then they could potentially pass that on to their baby. And so ideally, the time to do carrier screening is before a patient even gets pregnant. And that's why we encourage these preconception visits to come in and go over your family history. And we can discuss if any of these testing would be appropriate if they're interested. And what it does is test the mom. It's just a blood test to determine if she's a carrier for these certain genetic disorders like cystic fibrosis or spinal muscular atrophy. And if she's a carrier, then we need to test the dad so that we know if there's even a chance it could be passed on to a baby.